Well, Canadian pop star Justin Bieber has revealed that he has been diagnosed with a rare disorder that paralyzed half of his face. The 28-year-old singer has therefore cancelled a series of shows in his latest tour until he gets better. The Grammy winner shared a video on Instagram talking about Ramsay Hunt syndrome, which causes facial paralysis and affects nerves in your face. The singer demonstrated that he could barely move one side of his face, calling the ailment pretty serious.
I have this syndrome called Ramsay Hunt syndrome, and it is from this virus that attacks the nerve in my ear and my facial nerves and has caused my face to have paralysis. As you can see, this eye is not blinking. I can't smile on this side of my face. This nostril will not move. So there's full paralysis in this side of my face. So for those who are frustrated by my cancellations of the next shows, I'm just physically, obviously not capable of doing them. This is pretty serious, as you can see.
And to discuss this topic in detail, I'm joined by Dr. Shehla Agarwal, who's a skin specialist. Dr. Shehla, thank you so much for speaking to Mirror Now. What exactly is this condition, Ramsay Hunt syndrome? How serious it is, and how does it affect the person and the physical restrictions that the patient faces?
First of all, it is something which is very common, not common in younger people. Justin Bieber is very young to get it, and in common language, we call it shingles or herpes zoster. Herpes zoster is caused by a virus, which is the same virus which causes chickenpox. So all of us, we have this virus living in our body. Whenever there is stress, which can be physical stress, it can be mental stress, our immunity is less, the virus regenerates and causes the infection of the nerves. Ramsay Hunt syndrome per se is called Ramsay Hunt syndrome because it was described by a scientist in 1907, James Ramsay Hunt, but it is simply a herpes zoster infection of the facial nerve in the ear canal. The facial nerves comes from here and it spreads like this. You know, it has 5 branches and it goes and supplies all the muscles of the face. So when the herpes zoster infects the virus in the ear, at that time, all the nerves which are supplying the muscles, so the muscles get paralyzed. So you can start from here. The person can't frown, the person can't close the eyes, there is drooping, there is no smiling. So it is a sudden condition, it is a serious condition, but fortunately it recovers. Actually, it recovers on its own within 2 to 3 weeks in elder people. But in younger people, we want to start the antiviral within 72 hours, within 3 days of starting the infection so that the viral load is less. You know, you would have seen over the period of time that lots of antivirals are being used, which may not be, effective at that time, very effective. Like antibiotic you take, it is very effective within 5 days. But antivirals we sometimes give to reduce the viral load so that the reinfection doesn't occur and the recovery is much, much faster. So within 2 to 3 weeks, Justin Bieber fortunately would have recovered. But yes, it is a very disabling disease when you have it.
Right. Dr. Agarwal, you did touch upon the causes of this particular syndrome, but I'd like you to explain in detail. Can we trace the causes to one's childhood? Are there any early signs that could help perhaps a person diagnose this condition much earlier?
No, this is a sudden condition which comes suddenly and gets repaired within 2 to 3 weeks. The virus which is there, which is the chickenpox virus, we all have it in us. It's a residual virus. You know, so many viruses and bacteria live in our body. So once it recurs, there is no childhood symptom. There is nothing. It erupts suddenly. You know, if you would have heard of shingles or herpes zoster in one part of the body, it is unilateral. On one side of the body, it can happen in any of the nerve segment. It can happen on your chest, it can happen on your legs, it can happen on your head, depending on which nerve segment is being affected. In Ramsay Hunt syndrome, specifically the ear canal facial nerve is being affected. That's all. It's not something which is unique. It's not something which you have the virus from the childhood. It can happen. And frankly speaking, let me tell you, all of us are prone to get herpes zoster at some or the other point of time in our life. And I always say, let's pray it does not affect the serious nerves of your body, because once the facial nerve is affected, the paralysis is very disabling. Maybe it's even for 15 days, 21 days. What happens is he cannot close his eyes. When you can't close his eyes, the tears are not able to lubricate the eye. So the chances that there are corneal abrasions or there are chances that there is corneal injury is much, much more. So the paralysis will pass off. Paralysis, even if you don't do anything, the infection is self-limiting. Within 2 to 3 weeks, it will pass off. So to prevent residual injury and to prevent the severity of the infection, we give medicines.
You're making that the paralysis may pass off, but correct, but one of the repercussions that one could see, the fallout rather, is that it could perhaps lead to corneal infection because you cannot blink your eye, and that could lead to no tear in the eye, and that could be very injurious. Doctor, I'd also like you, specifically in this case, the Justin Bieber case, where the doctors in his case have said that it's very promising that Bieber only experienced partial paralysis. You've said that it could take about weeks or maybe even months to recover. But how many months in general could it take for a patient, and in this case, Justin Bieber, to recover from facial paralysis? And what's the percentage of recovery among such patients?
Recovery is almost 100%. And the recovery rate is 3 to 4 weeks. In 3 weeks, 90% of the patients recover, but most of them will recover in 4 weeks. The problem is that, as I said, that the virus will recover, but residual changes. There is something called as post-herpetic neuralgia. It means that the nerves become sensitive and there is pain in that area for prolonged time, which might be a year or two. You have to understand what nerves are. Nerves are like copper wires, and on that there is a rubber covering. So that's why when there are signals going in, there is no jingling and there is no paralysis. But once the virus affects the nerves, it causes holes in this rubber coating so that the nerves are jingled, the nerve is paralyzed, and when it recovers, then also there are holes. So the pain is there. You know why neural or neuralgia? Paralysis will come and go. We are actually, waiting for the time to pass for the paralysis to go. We want to prevent what might happen, because during this time of paralysis, if during this 3 weeks he does not take proper care, fortunately he has taken the tour off. If you are not taking proper care, if you're not resting, if you're not taking care of the associated organs, which, like I talk about the eye, there is lots of pain in the jaw region, there is lots of tingling in the ears. So you have to take care of the associated symptoms, and once the paralysis is recovered, which will be, fortunately, within 3 weeks it will recover. After that, he will require multivitamins so that the pain, the residual pain which is left, goes away forever.
Right. So you did mention about the symptoms of pain in the jaw area, in one half of your face, even around the ear area. What happens in case a person neglects such symptoms? How severe could it get?
Yeah, if you neglect the symptoms, let's start from here. This is the facial nerve. So the paralysis starting from here. So if you're neglecting it, first of all, the skin will become very dry. It will be very itchy. The eyes will not close. So your eyes will get corneal infections. If you're not taking care of your teeth, there is constant pain in the teeth. There will be decay in the teeth later. Like, it's not immediate. And if you're not taking care of the lesions, which is there, like you're smiling, what happens is that the muscles are paralyzed. So if you clench your teeth, you're not able to, because the muscles are not working over there. So you will have dribbling of food, you will have dribbling of tears. So you have to take care of the hygiene so that residually later these symptoms disappear completely and you're not left with any permanent disability.
Right. Dr. Agarwal, thank you so much for sharing your inputs. In fact, I'm also joined by Dr. Mahesh Mangal, who's the Chairperson, Department of Plastic and Cosmetic Surgery and Senior Consultant, Department of Plastic and Cosmetic Surgery at Sir Ganga Ram Hospital. Thank you so much, Doctor, for speaking to Mirror now. I'd like to ask you, how common is it for someone as young as Justin Bieber, who is still in his 20s? He is just 28 years old. So how common is it for someone as young as him to receive such a diagnosis? Because from what I've read is that this syndrome is typical for those who are in their 40s to the 60s age group. Dr. Mahesh, I think you were talking with your microphone on mute, sir. Can you unmute it?
Can you hear me?
Yes, Dr. Mahesh, go ahead.
Yeah. Basically, what happened that when there is a paralysis of any person, then the muscles become weak. On the side, the muscles become weak. Patient has we can't express whatever the expressions. Particularly in cases of facial paralysis, there is a difficulty because the patient can't close his eyes, so there is a eyes problem. Usually, in these viral infections, it recovers, nearly complete recovery takes place, as Dr. Saab has told us that in 3 to 4 weeks time, or maybe little longer, that these recoveries take place. Sometimes there are partial recoveries, particularly in cases of eyes or on the cases of face. If there is a problem in the eyes, then because of the paralysis, one can't close his eyes. Then if it is not recovering spontaneously by on its own, sometimes it needs some physiotherapy, maybe for a longer period. But despite of all these things, if it doesn't recover, then it require for closing of the eye, it requires a surgery in which sometimes a gold plate or a gold plate is implanted in the upper lip, or sometimes it is severe, then some other surgical procedure has to be done.
Right.
Particularly in cases of face, we are talking about the eye. Now that if it is in contrast of the face, if the facial muscles are weak, patients have different facial expressions, or there is sometimes difficulty in chewing. There is some leakage of food or saliva from the mouth. If there is a leakage, then there is certain reconstructive surgeries which has to be done to control these things or to have the facial symmetry.
Right. So can you also just enumerate these surgeries that you're talking about, the cosmetic surgery here in the case of Justin Bieber, or even by and large the gold plating and certain other surgeries? What role that does those surgeries play in recovering from facial paralysis?
Particularly in eye cases, this implanting of a gold plate is required, and if it is not even complete or recovery with even the gold plate, there is sometimes there is a few procedures called a muscle transfer or the nerve transfer, in which in cases of muscle transfer we transfer the muscles of the face from one part to the another, or from the scalp we transfer the temporal fascia, so that we can after transferring of the temporal fascia, we attach it with the upper or lower eyelid or with part of the face to function the normal functioning of that part, basically. So
Right.
there are multiple procedures. Depending upon the severity. If it is a minor case, then I think with the gold plate or with the small local transfer of the muscle, it works. If there is a complete paralysis, then sometimes the nerve transfer and muscle transfer or little complicated procedures are required to reconstruct or to make the symmetry of the face and to make the face functional properly.
Right. So the bottom line being here is that if at all you are facing such symptoms, to not neglect it at all and act in time. Thank you so much, Dr. Shehla and Dr. Mahesh, for sparing your time and sharing your perspective. Thank you so much.
Thank you.